there, welcome to the Healing Migraines Naturally podcast. I'm your host, Dr. Leslie Caesar, and I'm a licensed naturopathic doctor, former chronic migraine sufferer, and I've dedicated my life to helping other women with chronic migraines rediscover a migraine-free life. So welcome to the podcast. Great to have you here today. You are a returning listener and you're enjoying the information. Please subscribe. It really does help us with the algorithms to get this information out. So today we're going to talk about chiropractic treatment and migraines. So I am a licensed naturopathic doctor. I went to the leading naturopathic medical school called Southwest College of Naturopathic Medicine. Now it's called Sonoran University of Health Sciences. They recently changed their names, but naturopathic medicine has always incorporated the spinal adjustment techniques and also other, you want to say, joint adjustment techniques from the chiropractic and osteopathic tradition. So naturopathic medicine was sort of created or articulated over 100 years ago, and the chiropractors and the osteopaths were already on the scene. Really, the genesis of naturopathic medicine was to sort of unify the different, what we would call natural medicine therapies, or what we would call natural medicine theories of health and disease. At the time, they didn't really use the term natural medicine, but that's how we kind of talk about it today. So the naturopathic medicine movement was founded by doctors who wanted to sort of unify all of the different, like I say, we would call them natural medicine practitioners that were around: the homeopaths, the herbalists. There were some practitioners called the Thompsonians, the osteopaths, the chiropractors. The naturopathic medicine movement was founded to really unify all of the different schools, and sort of in naturopathic medicine, we do have a unifying view of what is health and disease, which that's one of the things that I talk about on the podcast, sort of the naturopathic approach. So, within chiropractic, right, they are really focusing on adjusting the vertebrae so that the vertebrae are properly aligned. And within chiropractic theory of disease, with the belief that if the nerves that are exiting the spinal cord and going through the little openings between the vertebrae and going out and innervating the body, if that nerve is not able to exit properly, if it's getting a little bit pinched, right? If the vertebrae are not lined up properly and the little opening, which is called the foramen, between the vertebrae is not adequate and it's impinging on the nerve, you're not going to have proper nerve signaling to that area of the body, and you're not going to have good function. So when we think of the nerves exiting our spinal cord and kind of innervating our body, we think of it as, okay, the nerves are going out into my arm and my legs. We kind of think of like our muscles, like our limbs being innervated by these nerves. But you have to also think about all the internal organs. The nerves coming out of the vertebrae, sort of in your thoracic area, they're innervating, your lungs. There's a vagus nerve, that's a cranial nerve that's coming out from the brain. It's not exiting through the foramen in the vertebrae, but you have your vagus nerve, which innervates your internal organs, but you also have the nerves that are coming out through your spinal cord, through the foramen in your vertebrae, also innervating the internal organs, every area in your body. Hi there. I want to jump in real quick and tell you about my client, Beth. She was getting 15 to 20 migraines and headaches per month, and as you can imagine, this was impacting her work performance and her confidence. She also has 2 small children, and she was starting to feel like she was a horrible mom because she had nothing left for them at the end of the day. But she reached out and she booked a free consult call with me, and after I asked her about her migraines and her health history, I felt confident that I could help her. I help women uncover the root drivers of their migraines and follow a step-by-step plan to dramatically reduce the frequency by up to 90% without adding more medication or taking a bunch of supplements. So we built her personal migraine map, followed the plan, and now she will get 1 to 2 migraines per year, which she uses ibuprofen to treat if she needs to, versus up to 15 to 20 per month when we first started working together that weren't responding well to any medication. She just reached out to tell me that she got a promotion at work, she's on top of her career again, and has been able to come off all of her migraine medication. But most importantly, she's a confident mom again, and she's attending birthday parties at Jump Zone with her kids and saying yes instead of saying maybe later. I've worked with women like Beth from all over the United States who were told, this is the best we can do, but they were still willing to dig deeper. So if you're serious about changing your migraine story, go to drlesliecaesar.com/apply or tap the link in the show notes, and on our free consult, we'll map out why your migraines keep coming back and the first 3 steps you can take over the next 30 days. I do cap new client spots each month, so if the calendar is full, the doors are closed for now. But if you're done feeling helpless and ready to do the work to heal, pause this episode for 30 seconds and book that consult call now. So chiropractic theory of disease is that disease starts because there is improper nerve signaling to the area due to what are called spinal subluxations. This is sort of like a misalignment in the vertebrae in the spine, impinging on the nerve. And so if you correct that, if you bring the spine into alignment, you're not going to have that impingement in the nerves, and then the nerve signaling is going to flow properly, and then that area of the body is going to function optimally. Okay, now, I think that there is definitely some truth to this, but it's not the whole picture. Okay, and this is one of the reasons why the pioneers within naturopathic medicine, they took a close look at all these different schools of what we would call natural medicine and said, okay, well, you think disease is caused by this, and you think disease is caused by that, but let's look deeper. What's a unifying theory of health and disease? And that's really how naturopathic medicine was founded. So I think that there's some validity to this, but I don't think that the whole reason why we get sick. So a lot of chiropractors will say that you are getting migraines because your spine is out of alignment. Now, you can definitely feel when the vertebrae are out of alignment. I've been trained to palpate the spine, locate all of the different vertebrae, and I can tell you from personal experience, you can tell when they're out of alignment. And then there's techniques to get them back into alignment, and you can tell the difference. If you palpate again, if you feel it again, and you did the technique correctly, you can tell that, okay, yeah, this is actually lined up. And again, I do believe that if your spine is not in proper alignment, things are not going to be optimal. But the question is, okay, why is your spine out of alignment? It's kind of a chicken and the egg question. The other thing you have probably noticed if you've gone in for chiropractic treatment is the chiropractor, when you start off, they'll say, okay, I need you to come in 2 or 3 times a week. Because when you realign the vertebrae, the muscles in your spine have to hold the alignment. And this, I think, is not talked enough about. Okay, because again, how did the spine get out of alignment in the first place? If there was an accident, if there was an injury, right? I inadvertently bent over to pick something up and I heard a pop, right? We can have some sort of injury or accident that can pull things out of alignment. That can happen. And when it does, it's fantastic if you have somebody with the skills and the knowledge to be able to move that back. That's great. But in chronic situations, how did this get out of alignment in the first place? The muscles in your spine are holding the vertebrae in place. So we have to look at, are the muscles functioning properly? So if you have an injury, if you've been in an accident, and I've never been the same since I was in that car accident, and I know I have had a back problem since then. If you've never had a chiropractor or a traditional, well-trained osteopath, look at the alignment of the vertebrae, or, maybe your rib cage, right? Other joints in your body. I would definitely recommend that you do that, right? Because if something is out of alignment, anatomically, things are not going to function optimally. That causes a physical stressor on our body when we have an anatomical issue. And like I've talked about on the podcast, ultimately it's our lack of resiliency and vitality in the face of stressors, in this case it would be a physical stress, that is driving the susceptibility to the migraine. But if that's not the case, right, then it's not going to be very helpful to you, particularly if you have a chiropractor that's in this straight school of thought, okay, and is just all they're doing is adjusting. They're not addressing, okay, why were these muscles not able to hold the vertebrae in alignment in the first place? That's what really has to be looked at and addressed. And, that's what I'm doing with my clients. I'm assessing, okay, do we have adequate nutrients going to the cells? Are we getting the waste material out of the cells and out of the body? Do we have adequate resiliency and vitality? When I'm working with my clients, I'm assessing for these three principles and determining exactly where we have deficiencies or blockers, and then what's going to be the best way to address those things. When we do, the body is going to respond because that's what it's designed to do. And many people will, like they're turning their neck and, oh, I hear the cracking, right? You can, if things are a little glitchy in there, you can kind of tell yourself if things are a little out of alignment, if your vertebrae is a little out of alignment. When we get those three things to the muscles, suddenly they start to hold better alignment. Okay, so even when people have a misalignment in the vertebrae and they're not able to get into the chiropractor, many times we see a noticeable improvement, less clicking, less popping, a better range of motion, just by addressing these three principles. Because again, when your muscles have what they need to function optimally, if they're the muscles that are surrounding your vertebrae, they're going to hold your vertebrae better. If you're just getting chiropractic and nothing is being addressed to make sure that the muscles have what they need to support your vertebrae, you're going to be going in for a lot of adjustments and not seeing a lot of improvement. So as far as, if I have a client, and they say, well, should I get chiropractic care? The skill level of chiropractors and traditional osteopaths varies tremendously, right? A very, very skilled practitioner can be very, very valuable. I personally have a very skilled osteopath that I see locally, and I take my daughter to. She got injured in gym class a few years ago, and she had a joint in her hand get out of alignment. I was able to bring her into him, and he was able to get that back into alignment, right? This is really a godsend when you have a really skilled practitioner, because you can get injured, you can have your anatomy get whacked out of alignment. It's very helpful to have someone on board that can help you get that brought back into alignment. So I don't routinely recommend that people get chiropractic care or osteopathic care unless there's something in the history that really points to it, right? So again, if there's an accident, an injury, sort of one of those sort of red flag situations, and they've never been evaluated, then, can we find someone local to you? Because I can't do it for you over the phone, but is there someone local to you that's skilled where we could get an evaluation done? But then, again, I want to make sure that my client is getting, good care from that local practitioner, because again, sometimes the skill level may not be there, or the approach is a little bit of a tunnel vision approach. If I have a client that is getting chiropractic care, and then we're working on making sure that the muscles have what they need to hold the alignment, I've seen very, very good results with that. And again, I've had many clients where they go into their chiropractor, maybe they've been going to the chiropractor for several years. We start working together, really start giving the body what it needs, and they go in for their routine chiropractic appointment, and the chiropractor says, oh, wow, you held the adjustment. You've never held an adjustment this long, right? The chiropractor can feel the difference, can palpate the difference in the body, and that's really good feedback for me to hear too, because then it's more data for me to show that, yes, we do have the right things in place. But, if someone's never gone to a chiropractor before and we don't have sort of a smoking gun in the history or a red flag in the history, I don't routinely recommend that people go. Can you get a migraine after a chiropractic adjustment? Yep, this has happened to people for sure, because it's a physical stressor. If your body is used to holding something in a particular way, even if it's out of alignment, and then you change that, that's generating a physical stressor on the body. And those of us that are prone to migraines and we're in the throes of a chronic migraine state, any little thing can be enough of a stressor to kind of tip us over into a migraine. So this, again, is another, consideration, because just getting the adjustment is going to generate some stress, some physical stress. on the body. So I hope this was helpful for you regarding chiropractic care and migraines. Like I say, I have respect for the chiropractic profession. I think they have a lot to offer, but I think the original sort of theory of disease of chiropractic, there's some validity to it, but it's not the whole picture. So thanks for joining me today. Again, if you are enjoying the content on the podcast, please give us a like and a subscribe. It really does help us get the word out. So I will talk to you guys soon.